Morning, everyone. Welcome to the Rochester Regional Health Mobile Mammography Center unveiling event. My name is Catherine Regala, and I'm an executive here at Rochester Regional Health and sponsoring this new program. We are very excited to celebrate with all of you this morning the launch of our new program. This new program provides breast cancer screenings. Rochester Regional is proud and honored to have been awarded funding to provide mobile mammography services in 8 counties known as the Finger Lakes region. These counties include Monroe, Ontario, Wayne, Cayuga, Seneca, Yates, Steuben, and Livingston. The multi-year funding provided for this new program is nearly $4 million and included funding for the custom design and build of a coach, the coach that is standing behind me, that is parked behind me. The coach that you will have the opportunity to tour later this morning, if you have not already toured the vehicle, is equipped with a 3D mammography unit and staffed by an expert team of professionals that you would expect at any one of our breast imaging centers. This funding was made possible through a generous program, Governor Cuomo's Get Screened, No Excuses initiative. This initiative is one of the most aggressive efforts in the nation to improve and expand breast cancer screenings across New York State. Rochester Regional Health is honored to be one of the 6 grant recipients in New York State and very proud of the fact that we are the only one in the greater Rochester area. Our objective is to increase the number of women who are screened for breast cancer. We will be successful in this effort by addressing access barriers to getting a mammogram. Women need convenience. We need convenient access, easy access to healthcare services. By bringing mobile mammography services close to where women live, shop, work, or work out, we will accomplish this objective. Women will be able to look up locations where we will be at, and they can call 922-PINK to schedule an appointment in advance, or simply show up without an appointment. We are encouraging, again, easy, convenient access and welcome walk-ins. Also, financial barriers are addressed with this new program. Typically, insurance covers the cost of a screening mammogram. However, if a woman is uninsured or underinsured, we have an established partnership with the New York State Cancer Services Program, which is a statewide comprehensive cancer screening program that provides funding for screening mammograms. At this time, I would like to introduce and welcome Dr. Ken Van Sickle, who is the medical director for our new mobile mammography program.
Good morning. I want to personally thank everyone for taking the time out of your, no doubt, busy schedules to come here today for the launch of the new mobile mammography unit. I'd also like to thank the incredible team of people that have worked so hard for so many months to bring this about. And Catherine will talk more about that a little bit later, but it put in a lot of work over a lot of time, a lot of obstacles, and to achieve something fantastic. I'd also like to say it's an honor to work with a health system that demonstrates time and time again its commitment to the community, and this is just one more example of that. I don't think I could overstate the importance of screening mammography. Breast cancer is the most common cancer among women. It accounts for about 25% of female cancers. It's the second leading cause of cancer death in women, behind lung cancer. In 2018 alone, over 250,000 women will be diagnosed with breast cancer, and approximately 40,000 women will die of breast cancer in 2018 alone. And although these numbers are terrible, there's been a relatively steady decline in death from breast cancer decade after decade since the 80s, and that's in large part due to screening mammography. Also due to increased awareness and improved treatment options and so forth. The screening mammography has played a huge role in that decrease. And although as the way things stand now, 1 in 8 women will be diagnosed with breast cancer in their lifetime, screening mammography can help minimize the impact of that by detecting cancers early and decreasing the death related to breast cancer. And when I say early detection, that's what screening is all about. The idea that you could detect a breast cancer before it is a lump, before it is clinically evident, meaning that it's more than likely still confined to the breast, not spread. That is what increases survival rates. 90% of breast cancers are detected with screening mammography, not through physical exam. So this should underline the importance of screening mammography. Early detection, women who are detected early, the survival rate at 5 years is 95%. The survival rate when a cancer is detected at a late stage is 20%. That's a significant difference, and that's a significant number of lives that can be saved, that have already been saved from screening mammography, and that can continue to be saved if we can increase or make available screening mammography to as many people as possible. And that's the goal of this coach. 1 in 6 cancers that are detected in women are detected in women between the ages of 40 and 49. Now, so although more cancers are detected in women over 49, that's a significant number. And at Rochester Regional, our recommendation is that we follow the American College of Radiology and the Society of Breast Imaging recommendations and begin screening mammograms where we suggest beginning at age 40 and having a mammogram yearly after that. That's if you're at average risk. If you're at above average risk, you would start even earlier. And whether you're at above average risk, that's a conversation you should always have with your doctors. Probably by the age of 30, you should have that conversation to determine whether you're at an increased risk or not, and whether screening you would benefit from earlier screening. But 40 is the age that we recommend. And detecting that cancer early is crucial. That's my main point here, is to drive that home. And the goal of this is to increase that. It's only 60 to 70% of women in the appropriate age group get screened right now. That's a large number of women that are not getting screened. There are a number of reasons for that, but the goal of this is to help women overcome some of the obstacles that they face, and to bring state-of-the-art 3D breast screening closer to where people live and where women live and where women work, and help them get screened and hopefully save more lives and decrease and limit the impact of breast cancer on women until it can be cured. That's all I've got. I want to hand it back to Catherine. But
thank you. So in closing, I would like to take this opportunity to acknowledge the encouragement and support of Dr. Eric Bieber and Dr. Bridget Weefling, as well as the executive team at Rochester Regional Health. I would also like to extend a thank you to the teams that have been hard at work for this program. Team members in imaging operations, in IT, in marketing, in finance, in grant accounting, and legal have been working on this new program for over a year. I would like to thank all that have participated in establishing this new program, and also the teams that will continue to provide critical ongoing support for this new program. Your dedication and commitment have been truly appreciated and valued. So thank you. If we could all give a round of applause to the team, many of who are here, for all their efforts, that would be appreciated. This new program is just another example of how Rochester Regional Health is leading the way in making women in our community healthier through more accessible and affordable care. With that, I'd like to thank you for attending, and I invite all of you to tour the coach.